For over 100 years, the road to becoming a doctor has pretty much been measured by one thing: time. Years in medical school, hours in residency. But what if we've been measuring the wrong thing all along? Today, we are talking about a massive shift in medical training that is completely flipping that script. All right, let's start with a simple question. Think about a pilot. Would you rather have the one who's just logged a ton of hours flying in perfect weather, or the one who's proven, without a doubt, that they can land the plane safely in a nasty storm? Yeah, me too. And that's the exact question that's shaking up medical training. And this lays out the difference perfectly. On the one hand, you have the old time-based model. It's all about the process. You put in the time, so we assume you're competent. But the new way, Competency Based Medical Education, or CBME, is all about the outcome. It doesn't assume anything. It makes you prove it. It verifies you have the skills before you move on. So here's our game plan. First, we're going to dig into this core conflict, time versus talent. Then we'll check out the blueprint for this new system. After that, we'll see what the new doctor's report card actually looks like. And finally, we'll look at the tough challenges this whole revolution is facing. So let's start right there by questioning the clock. Why is just serving your time not cutting it anymore? Why isn't it the gold standard for creating a great doctor? Well, the answer is this idea, CBME. At its core, it's a really profound shift. Instead of just following tradition, CBME starts with a question. What do patients and society actually need from a doctor? And then it builds the entire training program backward from there. The focus totally shifts from how long have you been in training to what can you actually do? Okay, so if you're going to build a whole new system from the ground up, you need a solid plan, right? So let's look at the 5 pillars that make up the blueprint for this new way of training doctors. And you should know, this isn't just a bunch of loose ideas thrown together. The whole thing is built on a really solid, well-researched model. You can think of it as the official architectural drawing for this entire new structure. And here are the 5 key steps, the logic behind the whole system. First, you define the outcomes. What does a doctor have to be able to do? Simple enough. Then you arrange those skills from the basics to the really complex stuff. Step 3 is huge. You tailor the learning because, let's be real, everyone learns at a different speed. Step 4, the teaching itself, is all focused on skills, not just memorizing facts. And the final piece of the puzzle, step 5, is this idea of programmatic assessment, basically a continuous way of measuring to make sure it's all actually working. Now, that last pillar, assessment, that's probably the biggest change of all. So how in the world do you measure if a doctor is truly confident? Let's take a look at the tools that make up this new kind of report card. The first really important tool is something called an entrustable professional activity, or an EPA. So forget abstract grades for a minute. An EPA is a real-world task, a high-stakes job. Can you manage a patient who's in shock? Can you lead a really difficult family meeting? These are the actual things a doctor does, and the whole point is for a supervisor to be able to say, yes, I trust you to do this. And what makes EPAs so powerful is that they're not theoretical. They represent the actual work a doctor does. They have to be observable, right there in the hospital, and they let a supervisor make a real-time decision about how much they can trust a trainee to work on their own. It's a game changer. So if EPAs are kind of like the final exam for a skill, how do you track progress? Well, that's where milestones come in. Now, it's super important to know these are not tests. Think of them more like a roadmap. They describe the typical journey a trainee takes as they go from being a total novice to an expert. So here's the bottom line. Milestones provide the big picture. A review committee can look at all the data from a trainee's EPAs and use the milestones to make a judgment call. Are they on the right track? Where do they need a little extra help? It even helps the program itself see if its teaching is actually effective. So this all sounds pretty amazing on paper, right? But actually making it happen in the real world, that is a whole other story. So now it's time to give this new system its own checkup and diagnose some of the very real challenges it's facing. And the problems aren't simple because they're all tangled together. You've got issues with faculty, the huge costs of resources and new technology, the nitty-gritty challenges of the assessments themselves, and maybe the biggest one of all, cultural barriers. Just that deep resistance to change. And this chart right here really highlights the biggest barrier. A staggering 2/3 of institutions report they just don't have enough faculty who are actually trained to teach and assess this new way. I mean, you can have the best blueprint in the world, but if you don't have the builders, you can't put up the building. And beyond those big picture problems, you have the day-to-day grind. All this focus on evaluation can lead to assessment fatigue, basically burnout for students and teachers. Even worse, you can get a checkbox mentality where people are just trying to complete tasks instead of really learning. Some worry this breaks the art of medicine down into too many little pieces, losing the forest for the trees. And of course, all of this costs a lot of money and runs smack into that powerful force of, but this is how we've always done it. But despite all these challenges, this is not just some experiment. It's happening for real, all over the world. You've got Canada, with its really structured competence by design system. And then you have India, which rolled out a whole new CBME curriculum in 2019. Each country is taking the core ideas and adapting them to what they need. And when you boil it all down, it comes back to this. This is a fundamental change in philosophy. It's about putting the needs of patients and society first, ahead of old academic traditions. It's about making sure that every single person who graduates is truly ready to practice medicine. So that leaves us with the million-dollar question, doesn't it? Is this the future of how we train all our doctors? Or is it a brilliant idea that's just too complex, too expensive for our current healthcare systems to actually pull off? The diagnosis, for now, is still pending.